callus formation is seen between what duration of fracture healing? I'll make it a little simple for you. Anybody who wants to understand this topic has to understand this concept of something which is called as fracture healing. Now, when we talk about fracture healing, please try to understand that we have a fracture fragment here, we have a fracture fragment here. So, whenever this so called fracture of the bone happens, the medullary artery, the cortical artery, the periosteal artery, they all undergo into some sort of a disruption, which basically leads to formation of a significant fracture hematoma in the surface. So I'm sure you all can see that there is formation of a significant fracture hematoma in the surface. So this is the first step. See, we are talking about biological fracture healing, so we have to discuss the biological steps. So the first step is always formation of a fracture hematoma. Now, a very interesting thing I want to put it across in front of all of you today, that a hematoma can be made within a day, two, three, four, whatever. But one thing is for sure, that hematoma is made within 7 days. One thing is for sure, that hematoma is made within 7 days. So within 1 week, you will find hematoma. Now, some of you might argue with me that what is the reason for formation of a fracture hematoma? Let me tell you today. This hematoma has a capability of doing chemotaxis. Chemotaxis means chemical attraction. And chemotaxis of what? Chemotaxis of the chemical mediators of inflammation. So all the chemical mediators of inflammation, whether prostaglandin, prostacyclin, leukotriene, interleukin, arachidonic acid, metabolite, COX pathway, LOX pathway, whatever, all these chemical mediators of inflammation are recruited by this hematoma to this fracture surface, and when they reach when they reach the fracture surface, they lead to what? Of course, they lead to inflammation. See, you have to understand their chemical mediators of what? Inflammation. So they will bring what? Inflammation. Now this inflammation is further divided into two parts. One is called as cellular proliferation, and the second thing is what is called as neovascularization. Now, what do you mean by neovascularization? Please try to understand that the vessels which were disrupted at one point of time, they will now be formed again. And as far as cellular proliferation is concerned, so new cells will start proliferating. When I say new cell, what does that mean? Osteoblast, osteoclast, osteocyte, histiocyte, chondroblast, chondrocyte. Believe me, it begins at the beginning of second week and it is lasting till third week. इसकी शुरुआत सेकंड वीक पे हो जाती है, but it goes till third week. So that is the fundamental of inflammation. Now please try to understand, in inflammation I categorically mentioned cellular proliferation, and in cells I mentioned all the cells, but today I want you to understand that out of all these cells, chondrocytes have got the fastest multiplication rate. And when you will see a lot of chondrocytes multiplying over there, those chondrocytes will lead to formation of just one thing over there, which is a lot of cartilage. And not only you will find a lot of cartilage, but you will also find some specks of calcium into it. So at this moment, when you see a lot of formation of at this point of time, when you see a lot of formation of cartilage with specks of calcification, so this is what is called as the third step. This is called as the third step of fracture healing. This is what is called as chondrogenesis. See, chondrocartilagenesis formation. Not only it is called as chondrogenesis, this is also called as the phase of soft callus. Now, some of you might be wondering what is soft callus. If you have gone through my description and explanation of the previous questions today, you'll be able to remember that callus is something which is contributed by the inner cambium layer of the periosteum. So now, congratulations, since you've done trauma to the bone, so inner cambium layer has come to start playing a role, and it has resulted into formation of something which is called as soft callus. And the soft callus is basically nothing but the first visible x-ray sign of fracture union. All right, so this soft callus is basically the first visible x-ray sign of fracture union. It is I would say this is radiological union. Let me simplify it in front of you. This is basically nothing but, this is basically nothing but radiological union. So what does that mean? That means that it is at this point of time that the radiologist gets an X-ray done and he says that congratulations, bone has started uniting. This usually happens at third week, and that is why now most of you will understand and be able to correlate that after a fracture, whatever treatment is given, orthopedic surgeon usually call the patient after 3 weeks to repeat an X-ray. We call it the check X-ray because we want to see radiologically whether callus is being formed or not. So congratulations, you have a soft callus, you have a cartilaginous callus, but you know what? At the end of the day, we don't want soft callus. We want something which is called as hard callus. Why? See, bone has just one basic principle to follow. Bone ke badle bone, bone in replacement of bone. Bone is supposed to be a hard structure. We do not want to have a soft structure over there. So now this soft callus will be converted to hard callus, and this hard callus is basically what is called as woven bone. But please try to understand how does this happen. See, I'll tell you. Soft callus formed at the previous stage. Third week, we go to soft callus, and we told soft callus that hello, soft callus, we don't like you. Soft callus is like, but why? I said, because you are soft. Soft callus said, sir, don't get angry on me. You can do one thing, sir. You can make bone within me. You can make bone within me. So when you say make bone, what does that mean? Ossification. Within means endo. Cartilage means chondral. So you can make bone within me. Endochondral ossification. Believe me, this begins at fourth week and it goes up till almost like sixth week. It is at this point of time that the clinician says that congratulations, fracture has started getting united. So, radiological union, today you have come to the conclusion that radiological union precedes clinical union. Radiological union corresponds to the formation of soft callus, clinical union corresponds to the formation of hard callus or woven bone. But you know what? But you know what? When we get this woven bone, you know what? When we get this woven bone, even at the end of the day, we tell woven bone that, hello, woven bone, we are so glad that you have been formed here, but you know what? We don't like you. Woven bone is like, bloody hell, why don't you like me? I said, because I told you, bone ka badla bone. So, bone will be replaced by that bone which was initially fractured, and the bone which was initially fractured is what is called as, come on, speak up, everyone, lamellar bone. So, woven bone is formed as a part of the clinical union, but at the end of the day, we need to understand that we don't like woven bone. We tell woven bone that woven bone he will be replaced with lamellar bone. How? We all are born as skeletal models. We injure our model, fracture our model. Almighty, so kind, Almighty says, don't worry, my son, my daughter, I will remodel you. So, this remodeling is something which is basically nothing but conversion of woven bone into lamellar bone. This is nothing but conversion of woven bone into lamellar bone. And this remodeling is basically done by, come on, speak up everyone, osteoclast. Now you will be able to correlate with one of the previous MCQs where I said that osteoclast has got two functions to perform. One is R for resorption, one is R for remodeling. So this is basically what is called as remodeling, which is the last step of fracture healing. Begins at the beginning of second year and it goes up till third year. And this is the fundamental of remodeling that I want you to explain. I wanted to understand and I wanted to explain. So, this is how the entire fracture healing happens along with duration. This is the most, whatever I've taught you right now is the most informative section of fracture healing. Now, if we go back to the question, then callus formation. See, first of all, they have not specified whether it is soft callus or hard callus. We presume they're talking about soft callus. It is formed at 3 weeks, so I think a better answer is this. All right, so question number four, answer is B, Bombay.